Are we on yet, Sam?
Just about to start.
Thank you.
So we're live now.
Thank you.
So,
Thank you,
when you're
Sam.
ready.
Thank you. We've got 19 viewers. Let's just let the viewers build up a little bit, Amanda, then we'll start. Okay, so thank you for joining this Facebook Live session. We're going to wait until just a couple more minutes to let more people get on the call. We've got lots of questions about the vaccination process, so just wait just 1 minute. I've got Amanda Sullivan. Thank you for joining, Amanda. She is the accountable officer for all the CCGs in Nottinghamshire. So we're very, very blessed tonight to have Amanda here. She can answer all your questions. And if there are questions tonight that can't be answered, don't panic, because I shall be emailing a copy of this video out and any unanswered questions tomorrow. So please don't panic. So we've got about 70 on which at the moment, Amanda, which is good, really. So we'll probably get a few more. So if you don't mind, Amanda, first of all, thank you for joining us tonight. That's great. It's giving you time up in the evening. Can you just give us a couple of minutes presentation on where we are with the vaccination process in Nottinghamshire and obviously particularly Ashfield and Eastwood?
Yeah, of course. And hello, and thank you very much for inviting me. It's good to connect with you. So the vaccination programme obviously is it's a massive scale of operation. In fact, I've heard people say it's a bit like scaling up a medium-sized supermarket chain in a month. That's the sort of scale of the operation across the country, but obviously really important, because what we want to do is vaccinate as many people as possible within as short a time as possible. And so the way that we've gone about it across the country is that we're targeting the most vulnerable people first, and the people who work with the most vulnerable as well, in a sort of face-to-face way. So our first people that we've focused on are people who are in older people in care homes, direct frontline health and care workers, then people who are over 80, people who are between 75, people who are over 75, over 70s, and then people, adults who have got conditions that make them very vulnerable to it. And the last figures, which is just over a week ago now, the last sort of published and validated figures, show that we've covered about 95% of the care home residents, over 85% of people over 80, over 70% of people over 75, and around 20% of people over 70. But that has changed, you know, that's every day, that's changing massively. So we've given, across the whole area, Nottingham and Nottinghamshire, we've given 128,000 vaccines over that, and that was over a week ago. And 44,000 of those were in that week, in that run up. So you can see that we've started with smaller numbers and then really scaled up the number of vaccines that we're doing. And we've got our local hospital, Sherwood Forest, has got a site at Kings Mill. And then we've got the Newark Showground, we've got the Ashfield Health Village as well. And we're also quite blessed because we've got the Mansfield Vaccination Centre at the old Wick site at Mansfield, and we've also got a pharmacy that's opened in Mansfield as well, which is one of the national pilots to see how this could work in your local pharmacies, local chemists. So and then the Prime Minister has pledged that everybody who's in those most vulnerable groups will have been offered their vaccine by next Sunday, actually, in those most vulnerable groups. And if we vaccinate everybody in those groups, that would have prevented 88% of the deaths from coronavirus that we've seen over this year, very sadly. So it's really important. As I say, it's incredible how all parts of the NHS and actually council, colleagues, police, others, you know, we've had people partly thanks to sort of Lee's pressure. Actually, we've had extra gritting going round, and that's happened today. Actually, we've had a few rounds all the vaccination sites. So it's scaled up really quickly. We're nearly there. We've got a final push this week with the most vulnerable cohorts, and then we'll be moving to the over 65s going forward as well. I would just say though that there are still more people to have their vaccines who are eligible. Everybody who is eligible should have had an invite by now to go on and either book to go at a site, or if you are housebound to have an injection either in your care home or in your home. There is transport for people who need it as well. It's limited, but for people who really need transport, there is transport. So I would say this is the best opportunity we've got to deal with coronavirus. It's only one of a number of measures. We still need to do all of our social distancing, stick to the lockdown, but it's really important, if you are eligible, do come forward and have your vaccine. We really encourage it. We still have got lots of people in the Ashfield area who are eligible for their vaccines that haven't come forward for them. So please do that. Thank you. That was sort of my introduction, Lee. Thank you.
Excellent, Amanda. So thank you. So I want to go straight through the questions. I've got quite a few emails that's come in. Yeah. But the first one that's been asked real time is a lady called Deborah, who says, I was at the Kirkby vaccination centre last week and they had to turn a lot of people away who had their appointments for their second vaccine. But when they arrived, they were not on the system at Kirkby. It was very awkward to send away some vulnerable people. Do we know what's gone wrong on that situation, Amanda?
So I'm very sorry to hear people were actually turned away. So what happened was, when we started the vaccination programme right at the early onset in December, if you like, the rules then were that you had your second dose either 3 or 4 weeks, or from then at least 3 to 4 weeks after the first injection. That was the national guidance. Then the public health guidance changed, and the gap between the first vaccine and the second vaccine was recommended at around 11-12 weeks rather than 3 to 4 weeks. And the reason for that was to give as many people as possible some initial coverage, because the evidence was coming through that even after one vaccine, it gives you good coverage. You do need a second vaccine, but there are benefits overall to the population by delaying that one. So I'm sorry that that message hadn't got through to those people, that their appointments were no longer, valid. They were part of the old, if you like, rules, not the current rules. So I'm sorry about that. I didn't know people had actually got to that point of turning up, but that's the reason. And appointments will be reissued for when people are around 11 to 12 weeks after their first vaccine, and that will be true for everyone.
Thank you, Amanda. So the first email question is from Trevor, and he says, why is it that I've had 2 letters telling me to book a COVID vaccination, and both of them will not let me book on the website or on the telephone? I've also tried calling 119 to book and have been told I cannot get one done. I've tried the NHS website to book it and it will not let me book. I have COPD, type 2 diabetes and ischemic heart condition, and I've been told I'm at risk by the doctor's surgery. So can we answer that one, please, Amanda?
Yes, thank you. So the letters might be, what happens is, if you've got particular medical conditions that put you in that clinically extremely vulnerable category, your surgery will have those on your notes, and that should trigger the letters. Now, there are letters that come out from the National Centre, and there are letters that come out locally as well. And it sounds like there's 2, and they may both be local ones, or they may be one of each. Initially, there was an error in the initial letter. People who were under 70 could not get onto the website, even though they were clinically extremely vulnerable. There is now a website link specifically for if you're under 70 but you've got medical conditions. So we have published that link, but we will publish that link again, and that should work regardless of your age. But we do ask that you take your letter to your appointment to say to prove, if you like, that you've got some medical conditions that need that, and then that should work. But it's a separate link for the clinically extremely vulnerable. So we have. I mean, if you you could probably pick it up online, but we'll publish that again.
Thank you, Amanda. So Victoria says, I am in remission after fighting leukemia for the past year, treatment ongoing, and have received my letter as a vulnerable person to go for a COVID vaccination, but I do not know what to do, as a lot of people I know work for the NHS have had their first vaccination and within a week were diagnosed with COVID, and with my immune system, I cannot risk it. Is it possible that there is a link between the vaccination and getting COVID soon after?
That's a really good question. So first thing about the vaccine, that we do know from the trials that when you have your vaccine, it takes you a little while to build up your immunity. And what they're saying is really until it's 3 weeks after your vaccine, then that's how long it takes to really build up the antibodies. But the research showed that after 2 weeks, you could start to see a difference between people who hadn't had the vaccine in terms of risk of catching it. So if you went along and had your vaccine and then you were exposed to COVID within that first week, you still would have that probably you wouldn't be protected in that way. And it might be that frontline workers like nurses and those would be more exposed to that risk. So it might be a coincidence that they were exposed to it through their workplace at about the same time they had the vaccination. So if they've had the coronavirus soon after the vaccination, that's probably because they caught it before they were protected. The other thing to say about the safety is we have got specific slots in the sites for people who have got issues with their immune system. And so that's partly why we've got the separate link to book for that. So I would encourage and say, do book in and go along. And as I say, there are special time slots for people who are clinically extremely vulnerable. Having said that, the sites are designed to be COVID safe, so practicing social distancing and those kinds of things. So if it's been medically recommended to you, I would say do go with that medical advice. Thank you.
Thanks, Amanda. So the next one is from Jill. Hi, Lee. I'm really worried about day centres. My daughter goes to Willowwoods Day Centre on Mondays and Tuesdays, and she's heard nothing about the jab so far. She's 48 years old, wheelchair bound, and has carers in 4 times a day. I think she is at risk. All her carers have had a jab, so I guess he's asking when she'll get her jab.
Yes, thank you. So I think it's a very good point actually, and it's something we've discussed. So we are following the national guidance, which was for people in care homes, older adult care homes only in this first set of cohorts. But in the next cohorts 5 to 6, then I think sort of people, of that age group, the 48-year-old, people with learning disabilities and physical disabilities would come more into that bracket. So I can't say exactly when that will happen, but I would anticipate that would be in the next group of people who are eligible. She should be.
Amanda, thank you. So Alan says, do you know when the over 60s will be vaccinated?
No, we're anticipating, obviously this Sunday is the deadline, if you like, for the target for us to have covered those first 4 cohorts. We're waiting for some national guidance around the next sort of cohorts, but certainly the next one will be over 65s, and then more into some of the younger, very vulnerable people, and then we'll be into the 60s. So I can't give an exact timeline to it, but that's the sort of the next sort of groups. So, and we are hoping to, again, I think there's an aim to get as many kind of people in those certainly by the beginning of May. So I think March and April, I think we're going to be extremely busy with second doses and those next groups.
Thanks, Amanda. We really get into them very quickly. So Tony, his question is, as the vaccines have been given emergency approval before the trials have ended, not sure about that, have those being given the vaccine been informed that they are in effect taking part as a subject in a clinical trial?
Yes, thank you. So it's true, the approvals process has been achieved quicker than you normally would with a vaccine. But that doesn't mean that the trials haven't been undertaken. So the research trials have concluded, and it was the evidence of those trials that went to the agency that, if you like, approved the vaccine for use. So people have been through clinical trials, and they were approved sort of early December, which was why then the vaccination programme started sort of December, January time in earnest, once those had come. So it's not a trial. The trial has been done. Having said that, obviously it's now going to a much wider group of people, and so we do have a process by which the impact of it is monitored. And obviously it's at very early days yet. We don't really know. You know, time will tell, won't it, how effective it is, etc. So, but the actual trials are over, so it's not part of a research project. But the information that people receive does say, you know, it is a new vaccine, but it's been through all of its safety checks and research checks.
Thank you, Amanda. So the next question is from Valerie. Why is the SwiftQ booking system so inadequate?
So what we've done, because obviously we had to scale that up we had to put it in place very, very quickly, and it was a sort of if you like, an established sort of package, software package, you know, that allows you to do that. So, and that there's been a huge amount of effort, and I think it's one of those things, like my comment at the beginning around, it's like scaling up a sort of medium-sized supermarket chain in a month. I think we have found some teething problems across the board, actually, and what we're doing is responding to them, and as quickly as we can. So we have done a lot of work to refine the booking system, and we will continue to do that as well for later cohorts. It's an ongoing process.
Okay, so we've got Megan, who says, is CFS, I don't know what that means, in the vulnerable category? If not, why not? I catch everything going and end up taking 3 or 4 lots of antibiotics when I do get an infection. It is an immunological problem and should be classed as so. I will continue to stay at home, even after restrictions, through fear that my immune system will not cope.
So I think if you have got problems with your immune system, it sounds from the question as though you haven't received a letter. I think it's definitely worth a conversation with your GP to see whether you are in that sort of, whether you could be classed in that eligible bracket. I would definitely recommend that you do that if you have got those problems. There is a national list of clinically vulnerable conditions, but there are some, you know, there probably are some sort of slightly rarer things or other things that perhaps haven't quite got on there. But I would definitely recommend, if you've got problems with your immune system, to have that conversation with your GP and just see from there.
Thanks, Amanda. So Cheryl says, as a parent carer in band 6, how and when will I be called for my vaccine? And do I need to provide receipt of carer's allowance or be registered as a carer with my GP? So
yeah, again, a really good question. So there is some national guidance that it describes the order that we have to call different groups in, from carers and things like that. So what will happen, well, certainly what's happened with the current sort of eligible groups of workers, is that the councils have got records of those people, and then they've used those records to, if you like, put those people into the system to be called for their vaccination. So I would anticipate something similar. As it comes round to your particular group becoming eligible, we will work very closely with the councils to understand who those people are, and for you to get called as well. So that my anticipation would be that would be the process for you.
Thank you, Amanda. So Graham says, I would like to know if it was a decision made by the Nottinghamshire policymakers to delay the rollout of the vaccine programme, in particular for the over 80s, the most vulnerable group, by comparison to our neighbouring counties using the latest NHS figures on the 4th of Feb. In Notts, only 33% of the over 80s had received their second vaccine. 0.1% of the over 80s population. Staffordshire had done 9,836, Leicestershire 16.2%, Leicester 3,541, which is 6.7%, and Derbyshire 6.7%. You must admit that Nottinghamshire made a dreadful start to this campaign. You have been playing catch up from day one and are still one of the poorest performers by comparison. Are you confident that the future deadlines and targets will be met?
Yeah, thank you. No, it's a very, very good question. So what happened at the outset was when the vaccine was approved, as I talked about, we were asked to nominate sites for that. And there was a window of opportunity to have the sites nominated. And then it was part of a national rollout, and there were phases of the rollout. And we were in the later phases of the rollout. That is a fact, and that's absolutely right. And so we have been playing catch up a bit. We have actually caught up a lot each week, and we continue to do that. And we're on track for the 14th of February. But that's right. But it was a combination of the allocation of sites, of the authorisation of them when they opened. And also, I think, us wanting to make absolutely sure that we sort of dotted all the I's and crossed all the T's on the safety of the sites. So it was, and it involved a lot of people, because there were community providers, GPs. There was a lot of people involved in those quite clinical discussions at the outset. There was also some, because there was a lot of restrictions on the Pfizer vaccine, there was more of a view about going for larger sites rather than, because that was before the AstraZeneca vaccine was sort of as available. So that is that. I mean, we didn't really sort of start vaccinating large numbers until into the new year. So that's right. Having said that, we, as I say, we have caught up, and as we've opened all the sites, we've really sort of increased the rates, and very, very close. So, for example, on the statistics that were published last week, we were at 85% of over 80s against the national average of 88. So we were really closing in that gap. With regards to the second vaccines, that's linked, because we'd started the vaccination programme, and as we established earlier, there were some people who'd gone through that had second appointments booked. But on the 30th of December, we received a letter which told us about the change in the rules nationally, about moving from 3 to 4 weeks to 12 weeks, 11 to 12 weeks. And so we were asked specifically not to continue to do second vaccines, but to maximise the number of first vaccines that we could do within those available ones. So it was a timing issue. Those other ones probably were done before that rule change came in. We were specifically told maximise the number of people that can get their first vaccine at that time. So that's why our numbers look different. It's actually not a bad thing. It's meant that we've actually been able to use those vaccines for first vaccines in the way that's been described. So that's why it looks different. And again, when we get into the 11 to 12 weeks, it will look like that for a few weeks, and then it will increase just as the first pattern happened.
Okay, thanks, Amanda. So Gillian, basically what Gillian wants to know is, are we looking at autumn as the earliest time for the Oxford vaccine to be updated? I guess she's talking about the South African variant here.
I mean, I'm not party to the sort of science, the scientists, but I have heard that they have said, haven't they, there was some quite detailed work and interviews that they gave at the weekend, and they did say that, you know, some sort of, you know, booster type thing with the different variants is, you know, quite a strong possibility in the autumn time. So yes, and it could be that it becomes a bit like the flu vaccine, that you have like a seasonal vaccine, because flu, you know, as viruses do, they change each year.
Okay, so Susan, have you heard when people who receive carers allowance who care for vulnerable family members will be getting their vaccine?
No, we will go with it's called the Joint Committee for Vaccinations and Immunisations. They publish that. So, and again, that would go through, we would work with the council on that to get the list of people eligible for that. Yeah. Okay,
so that's great. So Steve says, I've just been diagnosed with having diabetes, a swollen liver, spleen and kidney. I'm due a blood test to determine sugar levels 2 weeks after I received the vaccine on the 10th. Can that go ahead? And if I have water infection, which I strongly suspect I have, should I delay having the COVID-19 vaccine until the infection has been addressed? My GP surgery would not answer the questions. Instead, he told me I would get answers by doing the injection. However, I'm reluctant to accept that someone sticking a needle in my arm would have such comprehensive knowledge of the vaccine as to be able to provide me with the answers. It's a fair point. Should he have his vaccination?
It is a fair point. I think, so what happens is when you go for your vaccination, people have got access to the records. But I do think it would be worth another, I would, unless you're told not to, I would say go and have the vaccine. It would be probably worth another conversation with your GP just to check before you go, because sometimes there's different sort of levels of infection and things. So I think it probably, you know, if you've got a fever and other things, that might be one thing. But it is a bit of a clinical judgment on the day. So I would say, unless they say no, but perhaps have a conversation again with your doctor. And if they say go for the vaccine appointment and check when you get there, then I would be inclined to do that.
So I've got another one here, Amanda. Lynn, she's tried everywhere to get answers, really struggling. After an angiogram, she's got unstable angina, chest pains daily, maximum heart meds, blood thinners, high cholesterol, full meds, inhalers, struggling to breathe, can't do a lung test, needs stability first, loads of meds for hypertension and blood pressure. Went to the GP last week. She wants to be on the vulnerable list, but she's not on there. How does she get on the vulnerable list? And if a doctor...
So, as I say, the vulnerable list, again, it's nationally described as to what the conditions are that put you on the vulnerable list. But then, as I say, I think in the next wave of the injections, that will categorise more people in that category as well. And we're just waiting for the exact guidance on that. But again, I would keep that door open in terms of you know, your eligibility, and your GP will be able to help you with that.
Okay, so I think I've got Gail here. Some similar sort of question. 63, epileptic, type 2 diabetic, waiting for a vaccination, yet my brother-in-law, who is the same age, has already had his vaccine, yet he has no medical problems. Is there an emergency list I could go on if there are any vaccines left at the end of the day? As I could be at the Kirkby Vaccine Centre in 5 minutes.
Yeah, that is again a very good question, and we do sort of operate that we have a reserve list, but people that are in that eligibility thing, so that if it gets towards the end of the day, then people can be called at short notice, and that's been handy with staff, particularly frontline workers. But again, it would depend on you being on that list. And I think when that there'll be the over 65s, and then there'll be a broader list of people who have got vulnerabilities that would be in that next category. So it may be that she's on that list, but obviously that will depend on the national guidance.
Okay, so Lorraine's got 2 questions, so I'll ask the first one first. I'm a carer who visits an extremely vulnerable lady who is 86, blind and disabled, coded as housebound. 3 hours plus on my phone being pinged back and forth with SwiftQ, 1 hour. Told me to ring my GP, Willowbrook, who told me that they're not going to be vaccinated and call SwiftQ or Notts County Council. Rang Notts County Council, 45 minutes, told me to ring GP or SwiftQ. SwiftQ again, 1 hour and 10 minutes, told me to ring my GP. After much argument, they took the lady's details, probably filed in a rubbish bin. Can you please get help or clarity on this, Amanda?
I think if that's for the lady that's housebound, yes, rather than her as a carer, then we are. There's a couple of things we're doing. I do recognise that that's a problem. One is to put more capacity on the phone line, so that if you ring the phone line, I know people have been had a problem with getting through on that. And the other thing is to start to open out the SwiftQ booking to wider, so that some of the practices will be able to sort of help people book. So, I mean, if we can, if the lady wants to send specifics through, we can have a look at that specific case. But it should be that the GP, if she's on a GP's list of housebound, they should be, certainly as of the last couple of weeks and this week, I know they are visiting a lot of people, but we can check that she's on that list.
Okay. So the next question is, carers on 0 hours contracts and minimum pay are being told to delete track and trace. Also, ignore advice to self-isolate. Clients' families have insisted on going into parents then being diagnosed with COVID-19. As I am asthmatic but on no contract, so could never shield. What rights do we have to protect ourselves as a half-hour call leaves no time to disinfect possible sources, even with PPE?
Yeah, I mean that's very difficult to hear. That shouldn't be happening. I would say the Notts County Council helpline, I would say ring there and just see what can be done, because there should be, for carers, there's sort of rules that apply and things like that around self-isolation and protection. So I would say ring there and try and get some advice.
Yeah. Okay. I think the next one you sort of answered. I've just received my letter from my doctor that due to medication, it puts me in the clinically extremely vulnerable group for catching COVID, but not an invite to have the vaccine. So I spoke to the doctors and it's out of their hands. How do I go about getting the vaccine?
So there is, as I say, there's a SwiftQ link. So we'll publish that is specific for clinically extremely vulnerable. So it's got its own time slots and things. So we'll publish that, and then you can go on there, book your appointment and take your letter with you.
Yep. Okay, so the next one is from Tony. My appointment for vaccination was on Sunday, the 21st of Feb at Kingsmill. My husband only booked his last week and was allocated the 6th of Feb, again at Kingsmill. He suggested I try and change mine so we could attend together. Yes, I was offered a later appointment than him. And then I looked on the NHS website and out of curiosity found there was a choice of 43 appointments for yesterday afternoon at Ashfield Health Centre. I went at 3:20. It was not busy at all. Can someone please explain?
Yeah, so the first part of it is sometimes what happens is when we get a delivery of vaccines, then sometimes it's not very long notice ahead of when the vaccines are going to arrive. So if we think we can open up more appointment slots, then we will, because we want to use the vaccines as soon as we get them, or as quickly as possible. So it may be that that's why this lady's husband got an earlier appointment, because some slots were released later when we knew we could, you know, we had the vaccine there for people to go. So that would explain that, I think. I think also one of the reasons why at the beginning I did say, please, if you haven't had your vaccine and you're eligible, do go, because we are finding now that as we've got into the sort of, you know, mid-80% and high percentages for the over 75s, particularly, we're finding I suppose we're in the group of people that perhaps weren't the first and weren't you know, initially that keen, and they, you know, it might be that people have waited to see their friends have them and things, and hopefully you feel reassured now. So I think there are a few appointments spare now, actually, have been over the weekend, that was different from previous weeks. And I say, I think that's because we're getting towards the end of those cohorts. But also just to reassure you that we do have, what we've tried to do is give people as much choice for the time of their appointment as possible. So you might think there's lots of appointments on there, but just to reassure you, we don't waste vaccine. We'll book as many as we can for the amount of vaccine that we've got. So we're not wasting vaccine because of that reason. But I would say, if you haven't had your vaccine, do go along, and Ashfield Health, you know, it is there, and it, you know, I think we're very lucky to have. We've got quite a number of sites in our area, so we are lucky about that.
Okay, man. So you sort of answered this one halfway before. So somebody says, just a heads up, my parents, 80 and 86, were vaccinated on the 4th of January and given today as a second dose appointment, and they were emailed to confirm that the same day. At no time were they told the appointment was cancelled. So their son has taken them today to the vaccination centre and they've been turned away. I'm less than happy that the nurse in charge admitted nobody had told them the appointment had been cancelled, and only the fact that I was able to take them prevented a bus journey to Queen's Medical Centre for nothing. So that looks like somebody's time's been wasted. They've had their appointment cancelled, which they sort of accept, but nobody told them. Yeah,
I will look into that, because that's the second one, isn't it? Of that. So I wasn't aware of that, but I will look into that. Thank you. Yeah, I thought they had been actually, so but it's clearly they're not getting
so
to everyone.
Michelle from Kirkby says, hi, can IFA foster carers get the vaccination? I know that local authorities have been giving most carers the vaccination, but IFAs are finding it hard to get one.
So again, that's down to the national criteria, and obviously our first sort of port of call really is the people that are caring for the people who are most likely to be sick and very seriously ill as a result of COVID, which will be why it's like carers for older vulnerable people that are in that first batch. So, but it will keep under review over the time, but we will just work with that national guidance. But the focus has been on carers of people who are most vulnerable.
Okay, so someone's asking a question, Amanda. As you know, I volunteer at the Kirkby Vaccination Centre 3 or 4 times a week, and someone's asking, why did I get a vaccination?
So the way that there was a discussion about this, and I think this is happened across the country, that if you are volunteering and working at the site and coming into contact, and vaccinators as well, this is true for vaccinators and people who are volunteering and assisting at the site, a decision was made that volunteers who come into contact with lots of people as a result of their work, on the front line, would be eligible for a vaccine. So that was that. I would say though, that's always done secondary to people who are there on the day for their appointments, who are in those vulnerable groups. But that's happened across all of the sites.
Okay. So Derek from Sutton says, this weekend I received my first dose of the AstraZeneca due to me being a volunteer, and my wife received it as someone who is clinically extremely vulnerable. As the vaccine does not give very good protection against the South African variant, what do we do until the booster is available in the autumn? Do we still have to act as though we've not been vaccinated?
Yeah, that's a very good question. So the advice is that although it's great that we're able to roll the vaccine out as quickly as possible, we do still need to take precautions. It's very good news that it appears to prevent serious illness for people and hospitalisation. But I think the jury is still out on whether you can still catch coronavirus and transmit it. So even though it very much, reduces the risks of serious illness as a result of it. So really, we all have to continue to exercise the, wash your hands, cover your face, make space protocols, and keep doing that. I think, again, this will be in the scientific community, but I think the findings that they've done looking at the AstraZeneca vaccine with the new South African variant suggests that although people still do seem to be catching coronavirus with that, again, I think they are showing very optimistic signs that it does prevent the serious illness and death that we've seen without the vaccine. But that's very much work in progress, and very much, I'm sure, will be a scientific debate. But I think, again, a bit like the flu vaccine, viruses do mutate and change. That's what viruses do. And so it might be that we have some, new strains that come into effect in later vaccines.
Excellent. So Joanne says, you sort of answered before, but we'll just go through it. Hi, are all staff members in special needs score going to be offered the vaccination? I work in the kitchen and would like to know if we are eligible, please.
Yeah, so I think, again, schools and school workers, that's been hotly sort of discussed. At the moment, they're not being called for vaccines, but obviously will be kept under review. I know a number of professions, firefighters, for example, I think that is a national debate in terms of what's the right order of priority.
So Anne says, how come some people have no health issues or not at risk or work in any of the jobs that should be having the jobs or getting these already? Slightly confusing to me. They don't even have a job, most of them. So how come they jump in the queue? So how come some people are jumping the queue? I know, for example, I've seen it where the vaccination centres, when they're scrambling about at the end of the night, they try to get these vaccinations in people's arms as quick as possible. And that will mean probably that people do jump the queue, but through no fault of their own. They need to not waste these vaccinations.
Yeah, and I think what we're trying to do is absolutely minimise any instances of that. But as you say, I think sort of pragmatic decisions have been made at sites late at night on occasion. But what we're trying to do is make sure that we've got, so for example, from the councils, the care workers who are eligible, they can be called at very short notice. And I do know that staff have been called at very short notice as well, who are eligible in those frontline workers. That's what we would want to do most of all, is fill as many of the slots as we can with the right cohorts, have backup lists as well of people that are pretty mobile and can get around, late at night and things. But it is evident that has happened a little bit. But in general, we're really very much trying to stick to the cohorts.
Thank you. My husband's got pneumoconiosis. He's not heard anything at all, thanks. When will he get his vaccine?
So again, that'll depend on the national list. I mean, if it's helpful, Lee, what we could do is send that to you, and you could perhaps post that so people can have a look at the list of conditions that are on there, and then you can have a look at it sort of from your reference, really.
Okay. Next one is from Janine. She says, I have a question. I've been told by my doctor and my consultant that I cannot have the vaccine due to having anaphylactic shock and a rare condition called MCAS, which means I'm allergic to my own immune system and any cold or anything that wakes up my immune system and causes anaphylactic shock. So what happens to people like me? I'm extremely vulnerable and on immune suppressants. I'm shielding as work and I work in a very busy supermarket and I cannot have a vaccine. Am I left home forever and forgotten about? Reasonable?
Yeah, so again, another really good question. So it is the case that people with severe allergies are advised not to have the vaccine, because obviously we don't want to trigger another reaction, a serious reaction. So I think that's where I think that, I mean, so I've heard people say, we're not protected until everybody's protected. And this is the idea of having as much population coverage with the vaccine as possible. So the chances of catching coronavirus reduce massively. So I think for some people that really have got medical reasons not to have the vaccine, that's where I think it's a bit beholden on all of us to take the normal precautions of hands, face, space, and to have as many people have a vaccine as possible, and then that will reduce the amount of virus that's circulating. So I'm afraid that that's about as a whole community getting as much sort of protection as possible, really.
Okay, thanks, Amanda. Helen from Sutton says, why have so many Ashfield County Council office workers or District Council office workers and those working from home with all the NHS office workers at Kings Mill, along with those permanently working from home, have all received the vaccine before their age group requires? This is against published listings. I am 64, my husband is 75. He had his first jab, as he should have, and I'm still waiting my turn. Imagine how I feel whilst people under 30 and 40 and 50 have had a jab when they are not due. It's utterly wrong. Who facilitated this and why did they arrange this?
Yeah, no, I think that is right. And I think, so again, I wasn't aware of that specifically, but I think in the early days, there was I think the way that some of the guidance was interpreted was a bit variable, but we have been really clear now. It's frontline workers. I mean, certainly in the CCG, we've been very clear with CCG staff. We would expect people that are out in the vaccination centres and out in GP practices and clinical areas to have the vaccine, and people who are working at home to wait their turn. I mean, I've not had the vaccine. I'm working largely from home, and we can do that virtually. And so therefore I haven't had the vaccine. Excellent.
So Rose says, why can't teachers be vaccinated as soon as possible?
Yeah, I mean, I think this is another one of those. There are a few occupational groups, and I do think there'll have to be a national view taken on that, say teachers, firefighters, a whole number of groups that I think we'll go with whatever that decision is. But yeah, there are a number.
Yep. So this one here, I think I've asked this before, Amanda, to you. This is Maxine. She says, sole trader care providers, I think these are direct payment ones. How can they access a vaccination?
Right. So there is a form that if they fill that out, so what the councils are doing is collating of all these kind of, separate providers and small providers. So there is a form that is to be filled out, which sort of gets you on the list, if you like, for a vaccination. So again, we could share details of that as well. Okay, so I've got one chap who is a postman, and he thinks he should be at the top of the list for a vaccination. Can you tell us, Amanda, where postmen are in the pecking order? Yeah, and again, that's for further. I think we're waiting further guidance on that one as well. I think there's going to be a number of these occupational groups where people are out and about quite a bit. That there'll have to be a view about that. Yeah. Okay, thank you. So, Mr. Nixon, this question is very important. The vaccination rollout in Ashfield and Mansfield has been going swimmingly, but it's confusing to so many, including me, overseeing my father-in-law's health. I've had to ring a couple of times
as he's been given 2 dates to attend for his jabs. If this happens to everyone, what a mess and what a waste of time and resources to potentially thousands of people. Had I not dealt with it, he would have struggled to get through to the health village, to be told, you're not due, sir, not until late March, even though his appointment says February, which is a difference of 5 weeks. How can we avoid this and stop wasting time?
Is that a second appointment, I wonder, with an older person? I wonder if that's because of this issue about the different timings. But again, I'll take that back. But I agree, it is difficult to navigate sometimes, because there's the national letters that come out for people. There's local letters, and it's one thing I would say is it's really good that you've been able to help. And if people do know vulnerable people and that you're able to help them sort of, go onto the website to book or other things, please do help neighbours or friends or people that you're caring for. If you can, that would be very much appreciated. Okay, so we've got another one from a childminder and teacher. I think you've covered that to death, actually, Amanda. Peter from Kirkby says, do you think eventually we will be having an annual top-up COVID vaccine alongside the annual flu vaccine as a double protection? That's certainly being talked about. Again, it'll be a national decision, but that is certainly being talked about as a possibility. Yes, at least for a few years. Yeah, it is possible. And the next question is from John in Sutton. He says, why are some local GP surgeries not involved in the programme? For instance, our own practice, Woodlands Medical Centre, is not involved with the vaccination process. So when we set the programme up, what we were trying to do is, if you like, spread the workload across, or get as many health professionals involved as possible. And so in Nottinghamshire, we've got a very strong partnership actually between the community providers, who are sort of the lead provider, and the GPs, and sort of people returning, recently retired people coming back to work, and that's coordinated by Sherwood Forest Hospitals and the Nottinghamshire Healthcare Trust in terms of bringing all those workforce together. And we were trying to protect as much of general practice, if you like, core surgery, core services, as well as do the vaccine. And so there was an element of sort of how much the GPs felt they were able to do in the vaccination programme versus they might be more focused on covering some of the emergencies or urgent slots. And they are working much more together. So they work in these primary care groups, and the practices work together. So some of them may have taken a decision around sharing that different types of work out. Having said that, more and more practices are getting involved, and a lot, although they might not be working in the Ashfield Health Village, a lot are, in fact, most are doing their care home visits, their housebound, and those types of things as well. So they are working in groups, but they're sort of sharing the work out a little bit between themselves. And what we're trying to do is keep normal GP services going as much as possible alongside the vaccination programme. Excellent. So can you tell me, Amanda, how important the volunteers have been in Nottinghamshire at the vaccination centres? They've been extremely important, and we're extremely grateful for every single volunteer actually at all the sites. It's tremendous. It's really tremendous, and it's quite emotional actually to see how people have rallied actually at this time of what is probably it's a once in a generation event. So it's incredibly important, and we couldn't the marshalling, helping people to get into the sites, helping people, show people how to go through the process. It's really really invaluable actually. So thanks, Amanda. So this one's a really important question, I think. I have a 9-year-old son who's on the shielding list, as he's on oxygen. He's got bad lungs. Will kids like him be getting the jab? At the moment, the guidance is that only down to 16 years would be the youngest that would know. Obviously, the vaccine has been tested on adults, not children. And at the moment, the guidance is that it's age 16 upwards.
Excellent. So, Amanda, I'm going to bring this to a draw because we're coming up to 7 o'clock. I know I've got promised you for an hour. I want to thank you for your time. I've learned today that we've vaccinated over 12 million people in the UK. That's 25% of all adults in this country, which is a phenomenal figure.
Yeah.
I know we had a slow start in Nottinghamshire to start off with, but we've really ramped up, especially with the new centre in Mansfield. We're catching up. Look, it's not a race. We know that. It's important that we get as many people vaccinated as possible. Please send me some information tomorrow so I can send this video out to my constituents.
Yeah.
And I hope we've answered all the questions tonight. So if you can send us, some links to bookings for the vulnerable, for the over 70s and stuff like that.
Yes, we'll do that.
I'll put that off social media and I'll send it to my mailing list. And any other questions I've got, I've just dropped you an email actually while we're talking from a chap called Tony in Kirkby. He's concerned about his mother not having the phone call from the roving team. He's desperate to get it. So please look into that.
We'll look into that. Yeah.
And thank you, man. It's been brilliant. I'm going to log off any minute now. Thanks for your time. It's much appreciated. I know it's valuable and you've been a great help.
Thank you. Thank you very much. And thank you. Great questions, actually. And wish you all the very best, everybody, with your vaccines.
Thanks, Amanda. Goodbye. Good night.